So previously we talked about about a drug that increases your thyroid level, and now we're going to talk about drugs that are antithyroid. So antithyroid drugs. So drugs that interfere with the synthesis of thyroid hormones. So we'll touch upon carbimazole and propylthiouracil. Carbimazole and propylthiouracil, PTU. So what is the mechanism of action of carbimazole and propylthiouracil? So these drugs, as mentioned, they interfere with the synthesis of thyroid hormones. Okay, so by blocking the pathway towards synthesis of T3 and T4, triiodothyronine and thyroxine, so what you get is eventually a reduction in the levels of T3 and T4. So what are the indications for giving these thyroid blocking drugs, propylthiouracil and carbimazole? First is for the long-term management of thyrotoxicosis, and also to prepare patients for thyroidectomy. So we might give these two drugs, either one of these drugs, carbimazole or propylthiouracil, can be given with propranolol, okay, which is a beta blocker. So you give propranolol 3 times a day for the initial symptom control. So preparations and dosage of carbimazole and propylthiouracil. So usually we start carbimazole. So if we want to give carbimazole, we give carbimazole, and then we continue the treatment until the patient becomes, the thyroid level becomes normal, euthyroid. And that's going to usually take about 4 to 8 weeks. And then we reduce the dose gradually over 6 to 24 months. Okay, so reduce over a period of 6 to 24 months, meaning half a year to 2 years, to a maintenance dose. So reduce the dose until we slowly reach a maintenance dose. Sometimes we combine carbimazole, okay, with levothyroxine, so to balance out the effects. So, and we call this a blocking replacement regimen. Blocking replacement regimen. So carbimazole, we have tablets, okay, tablets. And then we have propylthiouracil. And propylthiouracil also we have tablets only. And how we do it is also we give it just like carbimazole. However, the maintenance dose is higher. I'm sorry, it's low. It's much higher because the maintenance dose for carbimazole is about 5 milligrams per day, and for this one, for propylthiouracil, it's 50 to 150 milligrams per day. So, what are the adverse effects of giving these two drugs, carbimazole or propylthiouracil? So, the main one is bone marrow suppression. So patients are supposed to report, they're supposed to tell you the symptoms and signs that are suggestive of infection, especially if they have a sore throat. Okay, so if they have a sore throat, they have to tell you and report to the doctor that they have sore throat, so that you might be aware and you can start be suspicious of what's going on. And if there is evidence of infection, then we will do a white blood count, and we have to stop. Okay, stop the treatment if there is clinical or lab evidence of neutropenia. Okay, stop if you have neutropenia. If your white blood cells goes down, so you have to stop. Neutropenia. And then the other adverse effects are nausea, GI disturbance, headache, and pruritus. So these are all both GI symptoms. So this is CNS, and this is, could say, skin or miscellaneous. Okay, and then we have for, so these are mainly for carbimazole. As for propylthiouracil, we have to be aware of effects like cutaneous vasculitis, hepatic necrosis, nephritis, and lupus-like syndrome. So this is pertaining to the liver, to the GI or hepatobiliary system. Hepatobiliary system. This is to do with the blood vessel. And then we have symptoms pertaining to the kidney. So the genitourinary system. Okay. And of course, it is more than the genitourinary system. So lupus-like means it's like SLE. So it's a systemic kind of manifestation. There are so many symptoms that you might see potentially with if you give propyl or propylthiouracil. So, and then we'll talk a little bit on the cautions or contraindications for giving carbimazole and propylthiouracil. First is liver disorders, because we know that, as mentioned previously, this drug can potentially cause hepatic necrosis. Okay, it can cause death of the liver cells. And another thing is just, of course, that this is expected from giving such a drug, that you might develop hypothyroidism. Okay, you get low thyroid levels, because this is an anti-thyroid drug. Okay, carbimazole, propylthiouracil are anti-thyroid drugs. So obviously, if you overdose or you give excessively the drug, patients might develop hypothyroidism. Okay, that's for now. See you in the next presentation.